So the Collaborating Center, we have been working with the McGill Collaborating Center to establish a virtual program of a school mental health literacy for high schools. So since the onset of COVID-19 and the premature closure of schools, many school-age students have been experiencing significant changes in their lives. So there's disruption in their sleep, we know, on their schedules, and separation from the peers, and the lack of intermittent access to internet has an impact on students. And clearly this also has an impact on the teaching personnel. So the school mental health literacy program is a program that PAHO has a virtual campus of public health platform, and this provided an excellent opportunity for us for the Collaborating Center to partner with us and the Ministry of Health. This was in Jamaica, and the Ministry of Health of Education, to do a training of trainers for the educators in terms of building their skills to be able to understand what is the relevance of mental health literacy, to be able to detect and manage mental health issue early in the classroom when the time will come for the reopening. And at the same time, not only building skills for them to have, be able to detect these issues with the students, but helping them in coping with their own stressors. So the goal here is to increase help-seeking behavior. Actually, it helps the mental health literacy program, and also helps to decrease stigma and early intervention. So we work very closely with the Ministry of Health, the Ministry of Education, and using the PAHO virtual campus to be able to deliver this program. Through the Collaborating Center, we were able to develop the program in a way that it can be delivered virtually. This is a program that has been delivered face-to-face, and it is normally delivered over a period of 5 days. And in this time, we were able to do it over a period of a month and a half, because we wanted to make sure we avoid a virtual fatigue. So the educators were connected twice a week for 2 hours. And they also had, in between the sessions, they have homework, they had quizzes. We wanted to make sure that they can understand the concepts that are relevant. And this is very important precisely because we know that 50% of mental health problems can be diagnosed at the age of 14. So we want to make sure that building literacy among teachers is extremely relevant to, as I mentioned before, to decrease the stigma, to detect for early detection. So we were very pleased that through the Collaborating Center, we work with PAHO country office in Jamaica, with Dr. Michelle Harris, who was the general coordinator of the program, and of course very closely with our PAHO virtual campus. So this is, I think, what's very interesting, to make sure that all of us together were able to develop a program virtually, specifically in the time of COVID, that can help not only the educators to cope with cope with the stressors of this pandemic, but also to prepare them when it's time to work with the students. We had qualified professors from Alberta Health Services who were actually assisting us in delivering the program, to make sure that this is a program that we to make sure that we have experts that are delivering it with the right concept. So I think this has been a successful work. Thank you.